guys, it's Stephanie Wolff over here at Novus, and I thought that we would put together a little video for you on the vampire facial. We have lots of patients who call in asking questions about it, so I thought what better way to explain it than to show you exactly what we're about to do. So Mary here has arrived. She arrived about 30 minutes prior to her appointment. We gave her some numbing cream. Some patients will actually come in a little bit earlier, maybe the day before, and we'll send them home with some numbing cream. But I just have her apply it on her face, a clean face. So make sure that you wash your makeup off first, put the numbing cream on, allow it to sit for at least a good 30-45 minutes, and then now I'm ready to draw your blood. So we're gonna draw your blood next, okay? And 1, 2, 3. And we're good. You good?
Didn't feel a thing.
Perfect. Okay, so now we have Mary's blood. I'm gonna put it into the little spin and press go. Takes about 10 minutes for the plasma to separate. So in the meantime, I'm gonna take Mary back into the room and get her prepped. So now what I'm gonna do is wipe off her numbing cream and then use a little baby wipe as well as an alcohol pad just to really cleanse the skin before I get started. Now I'm just going to transfer her plasma, if you can see the difference between the red blood cells, into a syringe. So what I'm going to do is just put a little bit of her plasma on her forehead. I always start with the forehead first, just to coat it real nice. Okay, Mary, so what we're gonna do is I like to cut our sections in half. So I'm gonna start with the right side of your forehead, okay? There's going to be 4 positions that I like to do. It's gonna be horizontal, vertical, and diagonal, okay? Once we're done with all 4, then I will give you a break and we'll move on to the left. Okay, 1, 2, 3. And see how she's already starting to bleed? That's exactly what we're looking for. That's the response that you want in a vampire facial. And now diagonal. And now we want to go the other diagonal. Almost there. That's it. All right, so now I'm just going to put a little bit of her plasma on. And that way it starts to go into the skin. She's gonna feel a little bit of tightness and warmth, almost like a sunburn. Okay, Mary, so that's all normal. Okay, all right. I'm just gonna put a little more plasma over here, and I'm gonna move on to the left side. Here we go. And we're gonna do diagonal. Last diagonal. And done. A little bit of plasma. Again, just to coat the skin. How you doing?
Doing all right.
Great. Forehead's the worst part, believe it or not. And the reason why is because it's so thin up there. You know, there's not a whole lot of collagen or fat. So I always do that part first because it's the worst part. Let's just get it over with, okay? All right, Mary, I'm gonna put a little bit of plasma on the skin to coat it before we get started. And same thing with the nose as the forehead. You know, obviously it's bone and skin, but it's a smaller section. I'm just gonna kind of get in here with the little pores. And we're gonna move to the other side. 1, 2, 3. Now side. And diagonal. And the other side. Doing okay? Moving on. Next side. 1, 2, 3. by side, and diagonal. Doing good? Mm-hmm. We're done. And side by side. Diagonal. And the other diagonal. And we're done. Where are we at? How are you feeling?
Doing great.
Okay, great. Cheeks are a little bit different than forehead and chin. It's thicker skin. So I'm really kind of looking for the same response that we got here. And everybody's a little bit different. If I start and I don't really see a response, then I'm going to bump up the millimeters. Okay? So kind of bear with me as I'm looking for our level with you.
Okay.
And I'm going to start on the outside. Okay. 1, 2, 3. See how I'm not really getting as much bloody response as I'm looking for? I'm going to just turn it up just a little bit. Okay, Mary?
Okay.
1, 2, 3. Okay, I'm gonna go side. And I'm gonna go diagonal. And now we're gonna go opposite diagonal. Okay. What I like to do now is kind of take this sensitive area and do it on its own. All right, but I want to make sure that I have enough plasma. And we're gonna go side by side. And then diagonal. All right, Mary, so we just finished up, and what I like to do next is kind of like what I call your final wipe down with plasma, okay? So I'm sure as you are feeling right now, your skin feels really tight. Right?
Right.
Maybe a little warm, like sunburn. Maybe a little itchy. Some patients will experience itchiness. So what I tell you guys in your post-op care is for the next 24 hours, I do not want you to wash your face at all. You are going home looking like this, and this is how you're gonna be for 24 hours, okay? So try not to plan any dinner parties or movies, grocery shopping. I had a patient who thought she was gonna go grocery shopping, unless you don't mind, you know, going grocery shopping like this. Now I always try to send you guys home with an extra syringe, as what I like to call your moisturizer. Just know that plasma is only good for 4 hours. So when you go home, go ahead and just use it yourself. That way you can kind of get some relief. Now in 24 hours, go ahead and feel free to wash your face, but what I tell you is just a really light cleanser. So maybe like an Aveeno or Cetaphil, CeraVe, something like that, okay? I don't want any kind of alcohol, salicylic acid, benzoyl peroxide, nothing like that at all. And quite honestly, I actually have you guys use coconut oil for the first, I would say 2 to 3 days afterwards. Number one, it's antibacterial, antifungal, and it's just a really nice moisturizer. As far as makeup goes, you know, you can go ahead and apply makeup after the 24 hours after you wash your face, but what you'll notice is that you'll be a little swollen, you'll be red, you might be itchy. Again, it's just like a sunburn, okay? That's what you're feeling, sunburn. after 3 days, now comes kind of what I like to call the flaking. Remember, if you have a sunburn, you do a little flake. It's not a peel, it's just a flake. So just be conscientious of that, and that'll last about a week. After that, that's when you actually start to see results coming. And when I say results, what I'm saying is just more even complexion. So I call it the porcelain look. Your skin actually looks like porcelain, and it's glowing and shiny, and everybody starts commenting, "What did you do to your face?" And you can tell them, I went to Novus and I got the vampire facial. Do you have any other questions for me, Mary?
No, I think you've answered everything.
Perfect. Okay. Well, I will be giving you a call tomorrow to check up on you and see if you had a good night, okay?
Great. Thank you.
You're welcome.